Through continuous feedback with the Project StepOne team and COVID Response Team, Puducherry Government co-created a platform where we brought in all stakeholders in COVID-positive patient management in a single platform. In this process, we invited 220 teachers, 40 NSS volunteers, and counselors from Puducherry University to volunteer with the government. In this system, on a daily basis, we receive a line list of all COVID positive patients in Puducherry, which we then upload in the system as tickets. The trained teacher screeners call the patients and verify and capture the information to ensure that further necessary steps of contact tracing can be enabled. Every morning between 8 to 11:30, the teacher screeners verify the patient information, after which the PHC team gets these tickets for further action. The PHC medical officer, through a combination of information in the ticket and field visits, further triages the patients to hospital team, CCC team, or home isolation. Similarly, once the ticket reaches the hospital team and the CCC team, they appropriately mark the patient in the system. They may mark them as patient in active hospitalization, or patient needs to be sent back to home isolation, or has been cured or discharged, or has been deceased, so to speak. And all home isolation patients then receive daily IVRS calls through the system, and if there is any change of symptoms, it is immediately raised to the PHC medical officers, who are then again using the app's cloud telephony system, are able to call the patient in time, and if necessary, visit the patient in person for further support like medicines, or escalating for other medical needs, for example ambulances, or being sent to hospital. And all home isolation patients then receive daily IVRS calls through the system, and if there is any change in their symptoms, it is immediately raised to the PHC medical officers, who then call the patients in time, and if necessary, they do an in-person visit for further support. Through this process of co-creation and regular feedback from all stakeholders on the ground, Project StepOne and Puducherry Government is able to empower multiple stakeholders within this healthcare ecosystem to get real-time information of the patient in distress and enable seamless coordination between various stakeholders. It is important to highlight that to co-create this system, all stakeholders, including technology platforms which empower the ticketing system, cloud telephony platform, backend servers, technical team members, and operations team, have come together to fight this pandemic all in a voluntary format, effectively at no cost to the Puducherry government. We believe the Puducherry model can be institutionalized to create what we call a national digital health corps, which can be roped in to fight pandemics and public crises of similar epic scale.